Right. Well, the new year means new leadership at UConn Health. John Driscoll is now the chairman of the Health Systems Board. He is also the new healthcare advisor to Governor Ned Lamont. And John is with me in studio this morning. Thanks for being here.
Delighted to be here as well.
We're going to talk about both of your roles. Want to start with UConn Health and speak directly to patients who are watching at home who think about things like A, access to healthcare, and B, cost. You're in charge now at UConn Health. What do you say to folks who have concerns in those two areas?
Well, I think that the great thing about UConn Health, which I think you know as well, is that we are one of the clinical gems of the Northeast. We're one of the top 10% of hospitals in terms of quality and care. We're the most likely to be recommended. And so we're kind of bursting at the seams. So we are actively looking right now to continue to expand access. We've increased bed capacity. We're looking to partner with the different systems around us because the demand shows that kind of delivering great clinical quality means you got to grow, and we're the fastest growing system in the state. So we're actively looking at it. In terms of cost, that's the responsibility. I just came into place with our new CEO, Andy Aguinobi, and we are very focused on finding ways to lower the cost and lower the cost trend and make sure that from a UConn Health system, we're getting the best deals for managed care and then can offer kind of better value for our patients.
I should have mentioned quickly, I am a patient of UConn Health, in full disclosure. When you talk about growth, a lot of folks are thinking about our smaller community hospitals and healthcare centers. I worked in that world before I got into TV. What can you say about the future of our smaller neighborhood hospitals? People have concerns about driving great distances for maternity care and other services.
Well, I think, speaking both from a UConn perspective and indirectly for the governor, one of the things we're looking at is to make sure that we have that primary care capacity, because as the state continues to grow and we continue to have a lot of inbound migration and our cities and our rural areas and suburbs are thriving, we've got to increase primary care capacity. So it's priority one in terms of the way we look at UConn and expanding access to the communities. The 22 communities we've actually got patient access in right now.
You speak glowingly about UConn Health, as you should. You were in charge, but in that role, or even working with the governor, where is there the most room for improvement in Connecticut right now? What are the problems you're trying to solve?
Well, I think if nationally, I think that we as a country can do a much better job at maternal and child health. We've got a primary care access problem that most people have experienced at one point or another. I think every hospital is expanding and trying to solve that problem. But as a state, I think we could do a much better job around maternal and child health. And that's something I'm working on with UConn and with the governor on.
So this morning, can you stand behind supporting these smaller maternity facilities across Connecticut, and people have those concerns about having to drive greater distances?
I think that's a challenge that we're working on every day. I mean, it is a community by community buildup. It's not just one size fits all solution. So Hartford is very different than Torrington, is different than Stamford, but it is definitely a priority. And it's not just access to maternal and child health. It is also that general primary care access challenge that we've got to solve.
All right, John Driscoll, the new head of UConn Health. I appreciate your coming in. You have a seat on the couch. Please come back.
We're delighted.